so you feel confident that we could accommodate a potential surge and reopen other services all at the same time?
Yes.
Okay, good. So we understand that the hospital needs elective surgeries to produce revenue. And it seems that at some point, and I think we've kind of covered this in the previous question, there's going to be a point when the hospital just has to move forward with its other services in spite of COVID.
Right.
And we would only really, if we restart those, we would only scale those back or shut those down if there was a surge much larger than what we've seen. Correct?
Yeah, and that's the whole, that's the whole focus of that demobilization team. So we literally have created an entire team. It's led by two of our vice presidents, Jag Bath and Ryan Gates. They have literally over this last week and a half, they're meeting with every single service line director. So I was out on our West Campus this morning celebrating its Nurses Week this week, and I wish we were celebrating in more of our grand traditional fashion, because our nurses, we have over 1,200 nurses, some of the most vital members of our healthcare workforce. Yesterday was the birth of Florence Nightingale. Yes, considered the mother of the nursing profession. Yesterday was her birthday, and so that's what always commemorates Nursing Week. But I was out on the West Campus this morning talking to folks. So our cardiac rehab program. So patients that undergo cardiac surgery, we very much want them to enroll in a formal cardiac rehab program after surgery, to continue to strengthen their hearts and everything about them physically, and help develop that new lifestyle center or new lifestyle. But it's been closed. So again, Jag and Ryan meeting with the folks in pulmonary rehab and cardiac rehab and endoscopy and all these services that are closed down. They're planning with each of them, okay, how would we bring you back up? How would we staff it? How would you open it and bring those services on in a way that, again, you could fall back if you needed to tighten it up, or you could expand it. So that's all part of this demobilization process. We do want to get the hospital fully reopened. I mean, it's been hard staying closed. We have so many of our employees that are out of work right now. Their hours are being cut. They're being furloughed. We have people that are working from home that are kind of going stir crazy. I want to be back there with my colleagues and meeting with them. I want it to get back to normal. But you're balancing that with safety. You want to make certain that first and foremost, if the community needs us from an acute inpatient, pneumonia, whatever comes with COVID, we've got to be able to do that. So it's going to be awkward. There'll be little fits and starts, but we're going to try to really make it as smooth and efficient as we can. And we'll continue to really to help our community understand as those services roll out.
Right.